So if anybody has any issues, I just wanted to let you know that we are recording this so that people will have the ability to watch it later on. And you're welcome to turn off your audio and your video if you do not want to be recorded. Okay, so another one of our housekeeping issues is that I'm going to ask everybody to put their microphone on mute during the presentation. If you have any questions, you can put them in the chat. In the meantime, while we're doing the presentation, put all your questions in the chat. After the presentation, we will open it up for questions. So you can either put your question in the chat or you can raise your hand and Danielle will call on you. So in the meantime, try if at all possible to maintain it on mute. We also put the pre-test in the chat. So it's going to be one of the first posts to your chat. If you didn't have an opportunity to complete the pre-test, please do that. Towards the end of the program, when we open it up for questions, we will put in the post-test. And then we will also send everybody a post-test at the end via email. So you can do it that way as well, either during your question and answer period or look for the email on the post-test. But both the pre and the post-test assist us in maintaining good programs, and we can then adjust our programs to better serve you. And it's important that you have the opportunity to complete these tests. Okay. Then some people are dialing in via phone, so they only have audio and they don't have the visual handouts that go along with the presentation. So I will try and cover all of the handouts, all of the slides in the entirety. Okay, so let's get started. Aging and health. Aging well depends on your genes, your lifestyle choices, and the environment. Catherine, would you mind muting, please? There we go. So when you think about it, even if you're healthy, changes in memory and learning as you age, normal aging, would involve that it's a little bit more challenging to multitask. And that you may notice if you had, let's say, a lot of things to do and you're trying to get them done and then somebody interrupts you, it's a little bit hard to go back and pick things up. It might take you a moment because you're trying to do many things at once and you have to focus on one item at a time. That's normal as we get older, that we need to focus on one item before we move to the next one. Otherwise, it can be a little bit more difficult for us to juggle many tasks at once. It's also normal aging that you have a little bit of difficulty finding the right word. You can often either describe what you want or choose a different word. And later on, you'll probably have that word come to mind. And so it's normal to do that. Additionally, with normal aging, you might have a decrease in your ability to pay attention and stay focused. So when you are getting older, just remember that as you age, you can still improve your skills. You're still able to learn new things and create new memories. That normal aging does not prevent you from doing this, and that you can improve your vocabulary as you age. So when it comes to aging and health, you want to adopt healthy habits. Things like staying involved in your community, using preventive services, managing healthy conditions like your medicines. All these that help you to maintain a healthier body, help you to maintain a healthier brain. You want to protect your brain health. And as we mentioned, good overall health will help you to maintain good brain health. So the things that you want to do, which as you know, are general things to improve your overall health, would be eat well, strive for healthy eating, take some time to exercise, fit it into your weekly routine to exercise several times a week. Keep your brain active as much as possible by engaging in learning new things or doing games, things that make you think. Also, you want to maintain social connections. Our brains stay healthier when we interact with others. And very importantly, but some people tend to overlook, is getting enough sleep. That's the time that your brain recovers. If you don't get enough sleep, you're not giving your brain time to do all of the repairs that it needs to do. And it becomes harder to focus and function the next day. When you think about it, our brain is our most complex organ. It's also one of the most important organs, and that's why keeping it healthy is critical. So it's critical now, it's critical as you age, and much of your brain health is dependent on the health of your overall body. As I mentioned, there are several things you can do. Let's start with healthy eating. Good nutrition is important part of leading a healthy lifestyle, both today, tomorrow, and in the future. Healthy eating tips include eating or drinking less sugar, salt, and solid fat. Make fruits and vegetables and whole grains a major part of your diet wherever possible. Choose lean meats, fish, and poultry. If you're eating a lot of red meats or something, try and reduce your portion size or just eat a little bit smaller. Not that you have to cut it out totally, but try and increase the amount of lean meats, fish, and poultry. Choose low or non-fat dairy and control your portion sizes. That's a big part for many people as they get older because they don't need as many calories. So you can still eat similar types of foods, just make smaller portions of the ones that are harder for your health. Okay. And very important, especially as we age, is to drink an adequate amount of fluids, particularly water. But as long as you're getting good fluid intake, it helps your brain. And think about a healthy diet promotes brain health, and brain health can start at any age. The earlier you start, the better. But if you continue to keep a healthy body and watch your nutrition, then your brain will do better throughout the years. Keep in mind too, that the area agencies on aging, such as the Department of Family and Support Services here in Chicago, offer a range of nutritious services, including congregate and home delivered meals for people 60 and older. And if you're not 60 or over, you may also want to look at some of, like, let's say the SNAP programs, and there are other nutrition programs throughout the city that you can partake in. So make sure that you get a well-balanced diet. We mentioned a little earlier physical exercise, and maintaining a regular schedule for physical activity is one of the most important things you can do to stay healthy. It reduces your risk of diabetes, heart disease, depression, and stroke, and it can help you to prevent with falls and improve your balance. It may also improve the connections among your brain cells. So before you start any exercise routine though, it's important to talk with your healthcare provider to see what activities are best for you, to join programs that can teach you how to be active safely. If you're interested in some exercise programs, you may want to look at the Department of Family and Support Services guide for the online guide for seniors that we have right now that shows all of our fall programming, and some of those include exercises that are low impact that will help you with strength and flexibility. The important part is that you fit some form of exercise in that works for you. Staying active can improve your heart and circulatory health. You can even get some help with some disease prevention. So don't ignore getting exercise in, even if it's a chair exercise. It's an important piece of your health. Okay. Keeping your brain active through learning new things, or reading books and magazines, playing games, doing puzzles, taking a class or joining a club. Whenever you're learning new things, you're making new brain connections. And you may want to even combine the two activities of meeting new people by going to a new class, whether it's ceramics or something that interests you. You know, I don't want anyone to feel like they have to do Sudoku puzzles because they want to maintain good brain health. It's important that you find something that you like to keep your brain active. That when you learn new things, you're engaging your brain. Pick a hobby or just try something you haven't done before. All these new experiences create new brain connections. However, it's important to realize that no specific game or activity has been shown to prevent or slow the decline of cognitive thinking if somebody has a disease like Alzheimer's disease. Okay. So while it maintains good brain health, it's not going to prevent progressive degenerative diseases. And we've noticed, especially over the last 18 months, that social connections are so important to maintaining brain health. People who partake in meaningful activities say that they feel happier, and this reduces some other health risks as well. So try and find an opportunity to be social and stay connected by volunteering or working, joining a social club or gathering with friends and family, and trying programs at local community organizations. All of those will be helpful for maintaining social connections. Approximately 1 million adults over the age of 60 help care for grandchildren. And that's a wonderful way to maintain social connections. But again, like I mentioned earlier, no specific activity, including social engagement, has been shown to prevent dementia. Okay? All right. There are several brain health risks: accidents, alcohol, smoking, and related risks from smoking, some medicine or improper use of medicines, and certain health conditions. All of these are risk factors that can be a problem for maintaining good brain health. I'm going to turn it over now to Danielle Riley to talk about these risks in more detail. Danielle?
Thank you so much, Victoria, and thank you all again for joining us this morning. So Victoria gave a nice walkthrough of all these different things that we can do. And now I'm going to go into more detail on, again, those risk factors. So we're switching gears here a bit. And our first risk factor has to do with accidents. So accidents, we're not exempt from accidents because of our age. And it is important to know that the appropriate steps to take to reduce accidents, especially those that can cause brain injuries, because actually as we age, our risk for those types of injuries or accidents increases, as well as falls increases as we age. Now, falls are the leading cause of both fatal and non-fatal injuries for people who are 65 years of age or older. And another statistic to throw out there, according to the Centers for Disease Control, about every 11 seconds, an older adult is treated in the ER for a fall. So what we want to do here is we want to share with you today that falls do not have to be a part of life. They don't have to be the thing that, oh, as you get older, you're just automatically going to be prone and you're going to fall or have an accident. We want to share with you some things that you can do to decrease that risk of accidents and falls. Firstly, we have exercise, which would improve balance and coordination. There are very specific types of exercise programs out there. Tai Chi has been known to support increasing flexibility as well as improving balance and coordination. Also, when you're driving or riding your bike or a moped, however, you want to ensure that those safety measures are in place, like wearing your seat belts and helmets where necessary and appropriate. You can also take a fall prevention class. Now, this month has flown by us. We're already at the 29th here, but last week, or essentially around the third week of September, there's this thing called Falls Prevention Awareness Week. And the National Council on Aging, or NCOA, has a number of activities and resources that they provide year to year to support and educate and make the public aware about falls and how to decrease your risk of falls. There is also a coalition, a statewide falls prevention coalition here in Illinois that partners with other different types of community agencies or healthcare providers to be able to make, again, the public aware about how to decrease your risk of falls. It may be through assessing your risk by doing a fall screening, or sharing with you different types of fall prevention programs, or just handing you information so that you can know even how to get up from a fall if you were to fall. So I encourage you to check out the National Council on Aging for Falls Prevention. They also have this thing called the Falls Free Checkup. And it's like a short questionnaire, but if you were to answer these questions, it can give you an opportunity to assess kind of your overall risk of falling. Um, Also, plenty of programs, Tai Chi for arthritis and falls prevention, which I am officially a certified instructor, has been proven to support, again, that flexibility, balance, and increase your overall balance and coordination. There's also bingo size and matter of balance programs, I believe, that may be virtually being offered through our senior centers. So feel free to check out those programs. Again, they're evidence-based and have been proven to support decreasing that risk of falls and your fear of falling, as well as improving your balance, flexibility, and coordination. We move on to home safety. Now, home modifications can prevent accidents and help you to maintain independence when in your homes. So we encourage you to consider, maybe if you don't have grab bars in your tub installed for you to get in and out of the tub or shower, that might be something that you can do. Also, if you have areas in your home that aren't well lit, so if you think about when you get up in the middle of the night because you have to go to the restroom, you would have an opportunity to, be able to see better if you have some lighting that's there additionally. So adding more lighting to areas that aren't well lit, and also securing your throw rugs. If you have any rugs or carpeting that might be up that can cause a trip or a fall hazard, make sure that they're secured to the floor. So those are things for home safety. Next, you want to review medicines with your healthcare provider. And medicines, we know, can have all different types of side effects. So you want to have this conversation to ensure that none of your medications are ones that could put you at a risk of any accidents or falls because of the side effects. Now, our eyes are a gateway, and our eyes, we know, can see a number of different things on a day-to-day basis. So we want to ensure that our vision gets checked on a regular basis so that we can be able to see if there are hazards that are in our way and be able to support preventing those from happening. And lastly, getting enough sleep. And it's recommended about 7 to 8 hours of sleep per night. Thank you. So now we're going to talk about alcohol. And alcohol consumption can have effect on the brain and an effect on our brains. According to some guidelines, moderate consumption is about 1 drink per day for a woman, and it's about 2 drinks per day for a man. And when you factor in age, this could look much differently because there are sensitivities that happen as you age with regards to alcohol, and it can have different effects on your body. So, in fact, the same amount of alcohol that a younger person and an older person consumes can have a greater effect on that person who is older for this very reason. So, we want you to consider how much you consume carefully because alcohol can impair the communication among your cells in your brain. Alcohol can also cause drowsiness and dizziness. You can become fuzzy. It can impair your memory and slur your speech. In terms of the long-term effects of alcohol, it could interrupt your balance and coordination. Again, more longer-term effects on your memory. Maybe your emotions become a little irregular and not regulated, and your body temperature. And lastly, you want to ensure that alcohol is not mixed with certain medicines, which can be very, very dangerous combination. Next, please. Now, when we talk about smoking, we've all heard through commercials, you've seen advertisements about those long-term effects that smoking can have on one's health. And it can affect your heart, your lungs, and even your brain, because when you think about smoking, it impacts your levels of oxygen that are needed to supply to other areas of your body and our brain as our large organ. Now, there are many free resources if you are interested in quitting that are available if you want to stop smoking. And when you think about smoking and stopping, there are several benefits when you do quit, such as smoking can lower the risks of heart attacks, strokes, and lung disease. It can also help that blood circulate more, overall throughout your body a lot better. And of course, for the environment and for the safety of others, you're not exposing somebody to secondhand smoke when you stop smoking. Now, one thing I do want to mention here is that beyond the aspects of quitting smoking, we want to consider the quality of air. So it is important to limit your exposure to air pollution with things like wood burning fireplaces, if they're in your home, certain types of candles, the industrial areas, in the environment, some vehicles, they emit different types of emissions that can affect your breathing quality and the way that you are taking in as you're outside. Those pollutants can affect your lungs. And so we want you to instead consider and make a good practice of what they call good air quality days. And you may even hear reports on the news, or you can check into that information that would show you the index for good quality air and with what day is a good quality air day for you to go out and do those activities. Take your walks, or if you're doing outdoor exercise that's not by large roads where a lot of trucks and different vehicles may pass by, so that can help your breathing a lot better on those good quality air days. So making that a practice again to limit your exposure to those types of air pollutants, because in living in a big city, we know that there are tons of them out there. So ensuring that our lungs can carry all of that oxygen in the right way and support our brain. These are good things to put into practice. Next slide. As we talk about medicines, now it is critical to talk to your healthcare provider about medicines that you are taking because some medicines can indeed have an effect on your brain function. With medications, you definitely want to be sure that you are following the instructions that are on the labels and taking them safely. You also want to remember that some medications and alcohol absolutely do not mix, and this should be monitored accordingly. So, when you're speaking with your healthcare provider about medicines, you want to share with them and talk about all prescriptions and over the counters that you are taking. It could be eye drops, it could be a vitamin supplement. However, you want to include all of these because you want to ensure that there aren't any potentially hazardous drug interactions that could, again, affect other areas of your body as well as your brain functioning. You also want to talk to them about memory and brain functions, the side effects that could happen um, to your brain from these different types of medicines that you may be prescribed or supplements or however that you are taking, and also whether any of your medicines can affect your sleep. Now, we are going to be, as Victoria stated earlier in this presentation, having our part 2 in the Brain Health series about medication, age, and the brain, which will take place on November 17th. And if you want to learn more about medicines in the brain, you are more than welcome to join us at that time. We will send you further information as it is available. Thank you. Next slide. Now, our health conditions themselves are a risk factor in terms of our brain health and can affect our brain. Conditions like heart disease, stroke, high blood pressure, diabetes, and sleep problems are conditions that could essentially even be chronic and you're dealing with them day to day. And it is important for you to seek ways to prevent them or appropriately treat these as you know, through active self-management. So what are things that you can do? What are resources you can seek out? If there's medications or however you want to get into a routine of talking with your healthcare professionals about these things, getting regular screenings and sharing if you are having any issues or challenges. And we're going to, with the next slide, go into more of these details on each of these. So with regards to heart disease, the heart disease can limit the blood flow through your body, which can include um, appropriate blood circulation to the brain. So with heart disease, again, because we're thinking about how that blood is traveling, it can have an effect on the way that it's reaching your brain is that blood, those blood vessels and the way that it travels. And when you look at blood pressure, if it is too high or too low, that can also be problematic for our brains because that airflow is not allowing, again, that blood to properly circulate through the arteries. Now, some things that can be helpful to support and reduce our risk of not having heart disease, high blood pressure, or stroke can be to manage your cholesterol. And cholesterol is actually one of those things that can be inherited, but it's also, if it's in not a genetic sense, has to do with our diet and the things that we consume. So you want to watch things that are high in cholesterol in your diet. You also want to control your blood pressure, and blood pressure can go high or low also, and being exacerbated by stress. So monitoring your levels of stress and finding ways to keep your blood pressure under control. Victoria spoke about healthy eating and how you should have a balanced diet that includes whole grains and fruits and vegetables. You want to eat the rainbow. There's this plate method that the U.S. Department of Agriculture has, and you can, I believe it's still interactive, where you can go on there and determine what types of foods that you desire to have more of to balance out your diet. And that is encouraged for you to incorporate limiting your red meats or watching your intakes of fats and your sugars. We talked about the effects on what quitting smoking could do, not only for the environment, but also for your overall health and your brain. as well as limiting alcohol consumption and your exposure to the pollutants that are in the air. Next, please. When we move into diabetes now, diabetes, there are two types. There's type 1, which is usually diagnosed in, childhood or young adulthood, and it is not preventable. It actually is usually caused by your body's inability to produce insulin. And then there's type 2, which is usually the result of more of an unhealthy lifestyle. Now, don't fret here because diabetes can be managed, but we did want to let you know that diabetes can damage the blood vessels in the body and the brain because it increases the risk of heart attacks, strokes, and memory problems like Alzheimer's disease. So through self-management techniques, you can control it. So you can do things to control or prevent it by maintaining proper diet, nutritious and healthy diet. So again, we talked about that eating the rainbow, um, monitoring your carbohydrate intake, your fats, having fruits and vegetables. Again, you can search the plate method and it will give you a nice diagram to incorporate if you feel like you'd want to add more variation into your diet. Also, weight management. So through exercise, managing your weight. I think I read somewhere once where if you took down 200 less calories a day, which might be a slice of bread or a cookie, within a year's time, that could equate to like 20 pounds of weight that you can shed. So just thinking about those lifestyle changes and things that can be done to support you, and, don't despise small beginnings. So you definitely want to start where you feel comfortable after having conversations with your healthcare provider, and you develop your fitness plan for what fits your lifestyle, and take those steps to manage your weight. And again, we talked about talking to your healthcare provider about medications, which again are very important, looking at that balance, those counteractions, interactions, those side effects, all these different types of factors that, because medicines can have an effect on our brain. And diabetes medication is also one that can, if and when necessary, be a support to individuals who are trying to keep their this disease under control. I also wanted to mention that there are some self-management programs out there. There's the Diabetes Self-Management Education Program and other programs called Diabetes Prevention Program. You can talk to a dietitian or nutritionist, but these are all things that you can do to ensure that you are able to maintain and continue to live your life with diabetes.
All right,
Now,
thank you, Danielle. I
you're welcome.
appreciate that. All right, well, we also wanted to talk a little bit about sleep problems, and sleep-related difficulties can affect your brain health by leading to injuries, cardiovascular issues, and memory problems. Some of the common disorders for sleep include sleep apnea, and that would be when part of your, excuse me, part of your throat kind of collapses where your sleep airways are. And they have certain machines that can help with sleep apnea. Also, a few other devices can assist with sleep apnea. And that's when, because of this blocked airway, you wind up not breathing for a little period of time. And over time, that can lead to further problems and heart disease and things like that. So you do want to speak with a sleep professional and have your doctor diagnose you for sleep apnea and say what's the best form of treatment for that. Other people have insomnia, and insomnia is when you're having difficulty sleeping and you don't sleep at many hours in the day. So the other one, pay attention to and speak to your doctor about, is narcolepsy. And that's when somebody has a sleeping disorder where they sleep at a lot of inappropriate times and often throughout the day. They just fall asleep and almost uncontrollably. Other sleep disorders include restless leg syndrome, where it's like your legs are almost twitchy throughout the night. So these things interrupt your sleep, make it difficult for you to get into a deep sleep, and make it hard for your body to then have the restorative function that sleep provides. So generally speaking, you want to get 7 to 8 hours of sleep each night. Certain times of life, people do sleep more. Like if there's an illness, they might be sleeping a little bit more. If teenagers tend to sleep 9 to 10 hours, but generally speaking, for adults, 7 to 8 hours is about the right amount of sleep. If someone's sleeping 9 hours, I would not get worried about that at all. Talk to your health provider or a sleep specialist if you are having any problems. And sometimes there might be a medical issue that comes up and it's affecting your sleep. And if you don't see the doctor about it, then it could get worse. So think about always talking to your physician about any sleep problems. You may need to ask your partner if or other family members if there are issues that you're having with your sleep, such as snoring real loudly, something that could actually be sleep apnea, and you may want to get it checked out. So if you're prescribed a device and like a CPAP machine or something, it's best to use it on a regular basis. If your doctor prescribes medicine, then follow the doctor's orders and you should be able to sleep a little bit better, but keep in touch with them. And quitting smoking actually helps with sleep, because when you think about it, with the nicotine and smoking, things like that, you want to try and avoid stimulants anytime close to when you want to get to bed. So things like, reducing the amount of caffeine you have close to bedtime. You may want to reduce the amount of screen time you have if you're on the computer late at night, and that blue light tends to stimulate people and then they don't sleep as well. Some people follow a routine that helps them relax right before bedtime. Maybe they shut off the TV and go to bed and sit there and read a book or something that will help them slowly relax. Okay, older adults should try and get to between 7 to 8 hours of sleep each night. Without adequate sleep, you're more likely to feel depressed. And you may have attention and memory problems without a lot of sleep. And that then can lead to further injury later on, because you're not as alert then because you didn't get the sleep. And if you're not as alert, you're not paying as much attention, and it can lead to slips and falls. If someone is sleeping way too much, it also may be a sign of depression, and they would want to go see the doctor about that. So just to let you know, sleeping many hours through the day is a sign of depression. Another issue to look into is dementia, and dementia is generally involves a buildup of harmful proteins in the brain and the death of brain cells and the loss of connection among those brain cells. So dementia is actually a word to describe a whole battery of symptoms. And those symptoms, most of them involve memory loss, confusion, inability to think clearly, sometimes emotional and social agitation. Well, the important part is this is not a normal part of the aging process to have those symptoms. So sometimes those symptoms can come from something as simple as a urinary tract infection. Those are easily treated with antibiotics. There are many other types of illnesses that can be treated that cause those similar symptoms. However, when most professionals refer to the person has dementia, or when lay people are talking about somebody having dementia, they're usually referring to the diseases that cannot be treated and are progressive and will continue to get worse. Okay, so some of those diseases that cause dementia would be Alzheimer's disease. It's the most common. You can have multi-infarct dementia. You can have dementia due to late stage Parkinson's. Okay, so with all of those types of illnesses, if you're able to have a healthy body as much as possible, then you're able to decrease the additional side effects that come from having other illnesses. So somebody could have both Alzheimer's and an infection. If you treat the infection, then their cognitive ability improves a little bit because the infection was making it hard for them to think clearly. It's not going to cure the Alzheimer's. Okay, so some of the risk factors of dementia are a person's age. That's the biggest risk factor. Another one is the genes, but the type of gene that causes Alzheimer's is not that common. So for most people, there is not a genetic component to Alzheimer's. There may be a genetic component for some of the other illnesses that cause the symptoms of dementia. But the healthier you can stay, the better you can improve your brain. Also, some of the people who have head injuries, even if their head injuries when they're young, later on, those can manifest as dementia. And you want to avoid head injury as much as possible. Stroke is another form of injury to the brain, often caused by blood vessels bursting or oxygen not getting to the brain. So with the stroke, that can cause dementia. Some of the ways you can prevent these injuries to the brain would be, as we discussed earlier, to exercise, to eat a healthy diet, to control your high blood pressure, or if you have heart disease, to take your medication. If you have diabetes, to follow your doctor's orders on that. And then there is something called cognitive brain training, and that's an approach that is thought to help people who are showing signs of dementia kind of keep track of what's going on. But again, this is just to reduce the risk as much as possible. And the cognitive brain training is good for people who have had injury to the brain. So some of the therapies that can treat the symptoms of dementia, but these therapies that are out right now, the medications and things, they aren't stopping the progression of things like Alzheimer's disease. They're maybe helping to slow it down a bit, but there isn't anything right now out that can cure Alzheimer's disease. Just to make sure everybody understands, you can keep yourself as healthy as possible, but if you have Alzheimer's, it will be progressive, and addressing the symptoms is the best we can do right now. So where do we start with taking a more active role in maintaining our brain health? It can be really difficult to take in all of these things, positive or negative that affect the brain. So you just want to start with one small step in the right direction. And that's what small step works for you. One of the things that we recommend that you do is that you schedule a health screening or a physical exam. Make sure that you're having your regular physical checkups on an annual basis. And for those of you on Medicare, Medicare beneficiaries are entitled to a free annual wellness visit. And also, when you first enroll in Medicare, when you're 65, you get a welcome to Medicare visit within the first 12 months of joining the program. So those programs, are free under your Medicare plan. You might as well take advantage of it and do that annual wellness check where they're going to screen for some of these issues. Another thing you can do, another small step to maintain your brain health, is to review your medicines with your healthcare provider. And when we say review your medicines, we're talking about over-the-counter medicines as well as prescribed medicines. I like to just put all the medicines that I take in a paper bag and go see the doctor with those in hand so that they can read the medicine labels. I do that with my mother as well, and it's an easy thing to do. You just take them, put them in a bag, and then you can show it to your healthcare provider. Another way is to just make a list and write everything down that you take to make sure that there's no interaction that could be detrimental to you. And we'll get into more detail about medicines on November 17th. So a third thing you could do is add one daily serving of vegetables to your diet, one more daily serving. Not that you only eat one serving of vegetables, but if you're used to eating, like, let's say, 3 servings of vegetables or fruits throughout the day, add a fourth portion. Or replace, let's say, a starchy food with a vegetable. Okay. It helps too to track your progress, whether it's exercise or making changes to your food. Keep a food journal and keep a exercise journal. And by keeping those 2 journals, you can actually see your progress. You may also, if you keep a food journal, get an idea for, like, let's say, a day where you really enjoyed the food that you made, your menu. Well, now that you can flip back and look and say, oh yeah, I liked what I ate that day, and that really worked for me. I felt energetic. Well, keeping a food journal helps to keep you honest, and it also gives you good ideas for days where maybe you're not sure what combinations you want for your menu. I like to go back and look at days that were really healthy for me. And the same thing with keeping the exercise journal. It holds yourself accountable. And you, rather than trying to remember, when was the last time I exercised? You go and you look at your journal and you say, oh yeah, it's been 2 days since I exercised. I think I better go for a walk today. And walking is one of the best exercises that we can do. And it's also a low impact exercise. So the last thing I wanted to talk about is that you can go to your local senior center, or right now, due to COVID, online. You could look at all the programs that we have that can help you with exercises and keeping active. Social activities are on there. There's like chair yoga on there. Also, the Park District is a good place right now to go to get involved with some activity. And they have some really good programs. A lot of them are outside programs as well. Okay. Well, basically, Danielle and I would like to thank you for your time. And this is the contact information. Okay. Um, So if you'd like to reach me, it's victoria.russo@cityofchicago.org. And then if you would like to reach Danielle, it's danielle.riley@cityofchicago.org. Our phone numbers are on here. You also have that on your registration information. With that, I would like to open up the presentation if there are any questions. Okay.
Very helpful. This is Mary. Hi, Victoria. Hi,
Hi, Mary.
Danielle.
Hi.
Thank you for your information. And I like that you said stressing the exercise and the eating right, which I've done most of my life, but I haven't been exercising like I'm supposed to. So that helps.
No, you're welcome.
And remember that anything that happened in the past is past. It's what you do moving forward that matters. What can you do today? If today's the first day of the rest of your life type of thing. You can,
Oh.
and if for some reason you have a weak moment and you don't get your exercise in, or you ate something that wasn't the most nutritious, just choose to move forward with healthier choices as best you can. We're all human and we want to try to do as much as we can.
Yes,
Thank you.
just a minute, thank you. Yes, Victoria, this is Notheria.
Hi, Etheria.
I have a problem. When I eat, I just get so sleepy afterwards. Since I'm older now, every time I eat, I'm ready to go to sleep. Is that a good condition or not?
Well, a lot of people do feel sleepy after a meal. You may want to decrease your portion size. Sometimes, the blood goes to the stomach and it helps, people feel a little sleepy after that. I believe it could also be a sign of some issues with your blood sugar. So I would discuss that with a physician as well. Danielle, you want to add to that at all?
No, I would say exactly the same, definitely looking at our portions. Again, a portion is what we put on our plate, and the serving size is based on the nutrients. So considering those things, maybe you want to test that out and see how that works. And, again, keeping that journal, as Victoria stated, and seeing where you notice if there are any changes, so that when you do make your follow-up visits with your healthcare provider, if you continue to notice those patterns, and those are things that you can have to discuss with them. So, it wouldn't hurt to try it out and see what those things might do, and if that's a help for you. We have quite a few questions. Um, there's a question asking about, is there a test for Alzheimer's?
They're trying to develop a test for Alzheimer's, but there's nothing on the market right now. Some of the things that they do to see if a person has Alzheimer's is largely under this assessment process. They're going to try and rule out all the other diseases that cause the symptoms similar to Alzheimer's and see that it's not those things. For example, they'll do a blood test and they're going to look to see if you have electrolyte imbalances or if there's an infection. They'll do a urine analysis, see if you have diabetes. They'll take a family history, what other diseases run in the family, to see if it's any of those diseases. They often will take a picture of the brain, like a CAT scan, an MRI, something. And there they're looking to see if there's any brain shrinkage, which is common with Alzheimer's. The brain gets a little bit smaller. The fissures between the brain get larger, and also the ventricles, that area in the center part of the brain that has the cerebral spinal fluid, that gets a little bit larger. And they can also look to see when they're doing the picture of the brain, they can see if there's any sign of stroke, if there's tumors or cysts on the brain. Some things can be treated with surgery. When my mother-in-law was showing signs of dementia and she had her workup, they found a small little water cyst on the brain and were able to drain that through surgery. So that's something, you know, again, a picture of the brain can show. They will also do a mini mental exam to ask questions about your memory and things along those lines. So it's good to have a full geriatric assessment as they look to rule out other things. Some of the direction that they're looking at for a test for Alzheimer's would be to see what the proteins in your blood are like, and if the proteins that are common with Alzheimer's show up in your blood. They don't have it at a reliable level yet, though. So, but that's underway, trying to look at that. And the only sure way you can tell right now if it is Alzheimer's is through a sample of the brain tissue. And they're not going to go in and get a sample of the brain tissue if there's no treatment for it, because what's the purpose? And therefore, the diagnosis is usually made at autopsy when somebody has passed away, if it's certain that it's Alzheimer's. I hope that answered your question.
Yes, there's also there's a couple people who asked about things that can be done for restless leg syndrome. Like, what are things that can?
Quite honestly, I'm not a physician and I do not know what can be done for restless leg syndrome. I believe that there are some medications that go along with it. Personally, I would probably try some relaxation techniques. I'm sure exercise does help with it though, but definitely speak with a physician if that's the situation.
Absolutely. Yeah. And
I have a question. Oh,
I'm sorry, you can go ahead and then I'll read this last comment.
going back to what Victoria was saying about the test. So do we go through, I guess, through the doctor so we can get this test, dementia test?
Yes, if that's a concern of yours, start with your primary physician and let them know what type of symptoms either you or your family member you're caring for are showing. And you're not going to make the diagnosis, but it helps to tell the doctor things like, I haven't been remembering things lately, and describe what went on and why you have these concerns. And then if they haven't said that they think you should take a geriatric assessment for dementia, you can ask them flat out, do you think I need to have an assessment for Alzheimer's?
Okay.
We're very lucky here in Chicago. We have two of the national research centers for Alzheimer's. And it's nice that in such a large city, we do have a lot of good resources to help diagnose the disease and then to support family members when they are caring for somebody with dementia. And in the early stages, to be able to support that person who has the dementia to live in their home for as long as they can.
Okay. Thank you.
Thank you.
We had and someone was asking about suggestions in regards to drinking water because it interrupts your sleep. So does anyone happen to have any suggestions? I guess we can put it to the group because that definitely can be I can understand a frustrator when you have to interrupt in the middle of the night to use the restroom, but anyone else run across that and have any suggestions?
Yes.
Okay.
Yes.
Okay, you can feel free to speak.
Drink most of your water before 6 p.m.
You got that right. Limit your water intake.
Mm-hmm.
Nothing, and depending on how early you go to bed, some people who go to bed a little later can limit it after 8. But if you try and get all of the water in earlier in the day and then stop it around 6 o'clock or right after dinner, no more fluids. That'll give your body a chance to process it, and you can go to the bathroom before you go to bed.
Absolutely. That's about my only tip for you as well. So I share that same sentiment. Try to get all my water in actually while I'm here at work, which has been proving very helpful for me. If I get up, it's maybe one time. So yeah, I second that. We had someone mention about how Mucinex helps with restless leg syndrome and fibromyalgia because of an active ingredient in it. In terms of this presentation, it is being recorded, so yes, it will be sent out with the post-test following today.
Well, once again, we'd like to thank everybody for their time today, and we appreciate you getting here. If you are interested in the Brain Health Series, we will be sending out notifications to everyone who attended today on our program on November 17th. So please look out for that. And if you have the opportunity, we really will encourage you all to complete the post-test online. If you have any difficulties with that, touch base with Danielle and she can assist you with it. All right. Well, thank you very much, Danielle. We appreciate your presentation today, and I hope you all have a good rest of the day.
Yes,
Take
thank you,
care.
everyone.
Thank you.
Thank you.
Thank you, ladies.
Thank you.
Thank you.
Thank you.
Thank you.
Bye.
Thank you.
Thank you.
Bye-bye.
Have a
Thank
blessed day.
All right.
Thank you.
Victoria, you can stop
Bye-bye.
recording.
Okay, now that's over.
You can